Welcome to our Neuropathy Health Breakthrough presentation. We hope that you find this information helpful, and most of all, we hope that you incorporate what you learn here into your healthcare goals. Before we go into the program, we want to establish some facts, such as what exactly is peripheral neuropathy? Peripheral neuropathy is a disorder of the peripheral nerves. There's the central nervous system, that's the brain and the spinal cord, and then the peripheral nervous system, which are the nerves that extend from the spinal cord. They travel down the legs to the feet and down the arms to the hands. On the right of this picture, you can see a healthy nerve with a healthy blood vessel. The middle picture, you can see diseased blood vessels causing the nerve to wither. And then ultimately, we see the nerve completely withered at the bottom. That's peripheral neuropathy. Peripheral neuropathy is one of the most common chronic diseases in the U.S. Actually, 8% of the U.S. population, or about 24 million people, have peripheral neuropathy. It can happen at almost any age. 30% of cases are of unknown cause, and another 30% are linked to diabetes. Are you tired of taking medications? Medications is definitely the popular way of treating peripheral neuropathy. Here's the problem. If nothing changes, then nothing changes. Both the doctor and the patient are caught in a terrible cycle. The peripheral neuropathy is treated, the condition gets worse, they prescribe medications, the condition gets worse, they use the maximum dosage of medications, the condition gets worse. Then they resort to using heavy-duty pain medications, the condition gets worse. Then the patient is completely debilitated or disabled, and as a last resort, there's amputation. A terrible cycle indeed. It is sad this country is in a healthcare crisis. Heart disease, diabetes, and neuropathy account for 75% of doctor's office visits. Do you know what the leading causes of death are? Number 1 is heart disease. Number 2 is cancer. Can you guess what number 3 is? Prescription medication. Prescription medications are the third leading cause of death in the United States. Over 100,000 people die each year from properly prescribed medications. Remember, each medication is accompanied by a host of negative side effects. Here are some popular medications used to treat peripheral neuropathy: Cymbalta, Neurontin, Lyrica, as well as opiates for the pain. You can see the side effects range from constipation to diarrhea to fatigue to headache to nausea to weight gain to vomiting. Not pleasant. Now, Neurontin is the most widely prescribed drug for peripheral neuropathy. Generally speaking, about 20% of all drugs are prescribed off-label. What that means is about 20% of the time, drugs are prescribed not for the original purpose that they were created for. Now, the use of gabapentin, also called Neurontin, has become so widespread that as many as 90% of the prescriptions are for off-label use, such as for the treatment of peripheral neuropathy. Again, here's the problem. Neurontin, or gabapentin, is not FDA approved for neuropathy treatment. The FDA has approved Neurontin for seizure disorders. This is a typical course of medication. First, 1 pill at 300 milligrams, then 2 pills, 600 milligrams, 4 pills, 1,200 milligrams, 8 pills, 2,400 milligrams, and on and on. Remember, as the quantity goes up, so do the side effects. It's interesting that we treat our cars a lot better than we treat our bodies. When our car shows a sign that something's wrong, such as the check engine light, what do? We immediately set an appointment to go into the mechanic or the dealership and have it repaired. We don't always do so with our bodies. When our body gives off signs and symptoms that things are wrong, oftentimes we cover them up, which would be the same as taking a piece of tape and just covering up the check engine light. No one would do that, right? Well, your body has signs, and your body's alarm are feelings like burning, cold, prickling, poking, aching, numb, vibrating feet. These are all signs that the alarm in your body is going off, telling you that there's a problem underneath. So let's delve into peripheral neuropathy. This is a great example. What do you see here? A frayed electrical wire. When the outside protective coating of the electrical wire gets withered away and the wire is exposed, you get a shock. Have you ever felt shocks in your feet or in your hands? There are different types of nerves. There are many different types that give off different types of sensations. Some nerves give off sensations of vibration, some cold, hot, light touch, heavy touch, position sense for balance, pressure, all these different things. Over time, pressure on these different types of nerves causes them to give off abnormal sensations. It progresses slowly for sometimes 2 or even 5 years, but at some point it has what we call the dropping off point, where it dramatically gets worse and it's very difficult to treat. There are different types of nerve fibers in your body, as we just showed. When you have problems with large fibers, balance and coordination become a problem. Loss of balance and coordination, and the need for walking assistance, such as canes, walkers, even sometimes a wheelchair when those fail. The big problem is that falls increase when you have large fiber problems. These put our seniors and anyone who falls lives at risk. Did you know that 1 out of 3 adults over age 65 experience a fall each year, and that 10% of all falls are fatal? The problem is less than 50% of seniors talk to their healthcare provider after having a fall. Another type of nerve fiber that gets affected, which is very, very, very undesirable, would be the small nerve fibers. This makes it so that the patients don't feel when their feet are cut or injured. If you experience numbness, tingling, pinching, sharp, deep stabs, or electrical shocks and buzzing, those are signs of small fiber problems. Ulcers and cuts that don't heal that form on the feet come from small fiber symptoms. The problem is we just don't feel those sensations, and the injuries occur over and over and over again. Deep cuts, broken toes, and damage just occurs repeatedly, and it never gets a chance to heal. If you have a problem with C fibers, you may experience burning pain. C fibers let your brain know that the normal temperature of your feet is, in fact, normal. Have you felt freezing or burning sensations in your feet or possibly in your hands? Those are damaged C fibers. Unfortunately, peripheral neuropathy is the #1 cause of amputations in diabetics. When something called nitric oxide is decreased in the blood, then we get a decreased blood flow to the nerves in the skin. When you get decreased blood flow to the nerves in the skin, that decreases their healing times when they have ulcers and cuts on them. This leads to infections and ulcerations, which ultimately lead to something called gangrene. Gangrene is when the tissue is actually dying and rotting off. In order to save the client's life, this can eventually lead to amputation. Not very desirable choice, is it? So what are the other choices? Well, classically, it's to go to the primary doctor and get drugs to mask the symptoms. And then it's on to getting referred to the neurologist for nerve tests and more medications. Let me ask you, have you ever heard of the word insanity? Insanity means doing the same thing over and over again, but expecting different results. That is true insanity. Have you heard this? Nothing can be done, and you have to live with it. We feel that restoring nerve function and health from the inside out is the best approach. Here, we take a comprehensive approach to treating peripheral neuropathy and feel strong that the best outcomes are a result of addressing the body as a whole. A critical and unique part of our treatment plan involves a complex supplemental program that enables all our natural vasodilators to help put the body back into an optimum position to heal itself. The body just needs a little help. Let's look back at the nerve pathology chart. At the top we see the healthy nerve with healthy blood supply. In the middle we see diseased blood vessels that are swollen, inflamed, and constricting that end up shriveling and then causing the nerve to shrivel and wither away as well. Remember, as the nerve withers away, it gives off those bad sensations associated with neuropathy. Another side effect of neuropathy is what we call hypoxia. Now, hypoxia means a lack of oxygen. Oftentimes, we see hypoxia of the legs and the feet. When a normal artery becomes thickened and swollen and inflamed, it's then prone to having plaque buildup on it. This leads to poor circulation and toxic buildup, Remember, circulation not only brings good things like oxygen and nutrients into an area, it takes the bad things away. With poor circulation comes toxic buildup. So our nutrition protocols for addressing peripheral neuropathy are as follows. The entire program is founded on nitric oxide and it acting as a natural vasodilator. Now again, to be clear, vasodilation means it opens up the arteries. Arteries are long tubes of smooth muscle. Nitric oxide causes these muscles to simply relax with no side effects. You know what happens is in our diet, we get increased sugars and starches. Those bind to nitric oxide and they reduce its efficiency. Then we have problems with circulation. The typical American diet is of high sugar, high starches, and this creates decreased blood flow within the microvessels, or the little tiny arteries, which feed the nerves that are involved with neuropathy. Sugars and starches also create inflammation in the artery walls, which further decreases blood flow. Here's a great drawing of vasodilation. On the left, we see a constricted, tightened artery. Not much room for blood. On the right, we see an artery under the influence of nitric oxide. The artery, smooth muscle, is relaxed and dilated. That's great circulation. In 1998, the Nobel Prize was awarded for research and work in cardiovascular health using nitric oxide. In addition to nitric oxide, our supportive nutrition is as follows. We offer a customized supportive nutritional program that allows your body to actually take advantage of the effects of nitric oxide. Now, under the influence and the effects of nitric oxide, the things necessary for healing can get to the tissues that need to heal, the ones that are starving for nourishment and oxygen, and the toxicity can be removed. Good news, everything we use is made from plants, naturally. So, what is your motivation? Why do you want to get better? Why do you want to stay independent? Is it for you? Is it for your loved ones? Do you have a bucket list? What's your motivation? If you're ready to get better, you may wonder, well, who specifically should come to see us? Well, could be you if you have one of these 7 symptoms of neuropathy. Numbness, burning pain, cramping, sharp electrical pain, prickling or tingling, if it hurts when you walk, if you can't sleep from the pain, or if you have balance problems. Upon your arrival, this is what you can expect. You'll fill out an application for admission. You may have already filled this out. You will experience a consultation. You may have already experienced that. Whereupon we're going to get a health history. We're going to understand about you. Most importantly, on your visit and or today, you will find out for sure if we can help you. Now, this is a family affair. If you're able to, bring a loved one with you or anyone who helps you make your healthcare decisions so they can best understand what you're going to be going through so that you get the best result. If you don't have anyone with you, that's okay too. Our advice to you is don't wait. Neuropathy is progressive. It gets worse with time. Please view the next short video and take it very much to heart.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
It's just, it's helping my system all over it. I can tell it's doing great things that I didn't realize. But it's great. I would recommend it. And for anybody, everybody's system is different. But it's like me, it's worth a try, and I'm proud I did. Thank you for your time.